the next topic area is about healthcare technology innovation. Um, we want to explore how healthcare organizations can advance innovation. So, developing new standards of care, more efficient workflows, and all of which aided by, AI adoption in some areas, all while maintaining cybersecurity and managing that risk. So, to talk about this topic, we have Chuck Christian joining us, who is the Vice President of Technology and the CTO at Franciscan Health, where he leads a lot of their digital transformation efforts. I've known Chuck for many, many years. He has been a driving force in healthcare IT for decades. He's a Chime member who we value very, very much. He's a Chime and HIMSS Fellow, past HIMSS Board Chair, and recipient of numerous industry recognitions, awards, and honors. Chuck, we are so glad to have you here. Welcome to this session.
Well, great. Well, thanks very much for having the opportunity. And Lisa, it's good to see you again.
Good to
And I,
see
I
you as
won't tell
well.
anybody how long we've known each other. So
Yes, it's been a long, long time.
been a
I've
long time.
appreciated the collaboration. So we are talking about healthcare innovation and all of the areas that I mentioned. I think really what we want to take a look at is how do you balance the desire and the drive for innovation in the areas that I mentioned while managing the new and sophisticated cyber threats? How do you strike that balance? And how do you work with your team to do that?
Well, I mean, luckily I have a peer who's the CISO. I've got a security background, but now I'm finally in a role that it's a secondary passion of mine rather than the primary. And so I think, as we've discussed before, communication, trying to keep up with the threats and where they're coming from is more than a full-time job. You really need a team to do that. And once again, I'm in an organization who can afford those level of experts out there because it's a multifaceted approach to security. You got to have multi layers in order to make sure you don't get in and partner with the right people in the organization. And the one of the things that we try to do is collaborate internally. Have a team, team management group along with the security team. They meet every day and look at everything, and they're monitoring, quite a few of the industry, blogs and newsletters, and we get threat analysis in from all over the place. And so it is absolutely the reason I have no hair, Lisa. That's all fallen out because of just the stress. I tell everybody it's because my brain has gotten so big it just pushes the hair out.
Thank you. Uh,
Children with that.
can you tell us a little bit about your innovation agenda? So what are the major,
Sure.
driving projects? We're going to go through in this discussion a number of areas that I've come up with, but I wanted to see, what's the imperative? What are the driving goals for the organization in terms of technology innovation?
It's easy. It's called patient care. I think you know that I'm a clinician at heart. I spent the first
Yes.
14 years on the clinical side of life before I lost my mind and I went into informatics and computer science. And I think that that is the thing. My passion is to make sure the technology is as invisible to the people that are providing care at the bedside. I'm married to a critical care nurse, so she reminds me of that each and every day. She doesn't practice. She retired a long time ago, but now I have the privilege of working, so she can stay retired. So, uh, and I,
Sure.
which is great. What we're focusing on is what will help uh, get rid of physical and cognitive load of for the caregivers, and I lump caregivers into not just the bedside nurses or the physicians. It's the respiratory therapists, it's the radiology group, it is in the OR, and so because I had an ablation because of AFib, and before they put me to sleep, I had to look at the room because I have never seen so much technology in a room and in my entire life. And so you can't sling a cat in a hospital anymore without hitting a piece of technology. And so it has to be a valuable tool, but it also has to be as invisible as flipping on the light switch and making sure the lights come on. So we're doing a lot of different things around virtual, around ambient, looking at, and of course, if you don't say AI at least 5 times, you haven't been to a webinar. And so that's my first time looking at, how do you develop agents to help work not only on the clinical side, but also on the productivity side. There's a lot of great places that we're just starting to learn. And the fact is, we have to balance that use of that technology and how do we secure? Because one of the things that I think that we did, if you remember high tech back in 2009 and the rush to automate everything in healthcare, unfortunately, we rushed and we forgot about securing everything. People say, well, healthcare is so far behind. Well, that's because we have this little thing called patient data that we are curators of, and we have to make sure that we protect that at all costs. And if we don't, there's other little thing called OIG and the other folks, regulatory agencies in the federal government will, they're just waiting for you to do something inappropriate. Now we even have the attorney generals at the state levels that also love to issue fines as well.
So you did mention AI, and this will be about the 5th time I mentioned it, but
there you go.
It's on my list, but it's not the only thing. So you are, adopting AI in the clinical workflow, and you mentioned, our concern for the sensitive data that we have. So
Yep.
you can roll out AI products on your own, but you also have embedded AI in your clinical software like EMRs, but also in your monitoring devices. There's data there. How are you sort of managing and governing the deployment of this, and what, how pervasive are the threats, and how are you managing those as well?
Well, Lisa, as well as I do, there's always, with an enterprise our side, we're a 13 hospital system, and it's pretty broad. So there is every day a surprise that gets dropped in. You'll have a cardiology group that is starting to use AI to look at incidental findings. We'll have, we contract out our imaging reading to a radiology group. They've been using AI for a very, very long time. We're an Epic shop. Epic has an absolute plethora of AI that we're looking at. And the one thing that we've done is we've put in a governance process that it has 2 prongs. One is on the clinical side, and the other one is on the productivity side or the operational side. And so I wouldn't tell you that we're perfect. I think that we're further along than some, but we're trying to manage it at the very beginning through governance and having the appropriate level of the senior leadership involved in those conversations, particularly on the clinical side, because it's paramount to know what we're going to be doing. And the other thing that we're very, very careful about, we're a Microsoft shop, so Microsoft has Copilot everything out there, and they're turning it on whether you want it or not, and then we have to go figure out how to turn it off. And the one thing we did, we ran some pilots, and we found even when we configured everything the way that Microsoft told us to, their agents could get to data that we did not want it to get to, and so we've been. Data management is not something that healthcare has done a real good job of. We can wall it off, for a variety of methodologies, but making sure that it's really secure, because those agents are like field mice. You take a field mice that you think you couldn't get into your house, but they can get in holes about the size of a dime. So the AI agents are about the same way. They'll get into places that you don't even think about. So I think we have to educate ourselves, just like we do the regular threats and stuff. The thing that really keeps me awake at night is some of the new things are coming out. As I mentioned before, that the hackers only have to be right one time. We have to be right every time. And so at some point in time, those AIs are going to be better than our AIs, and we're hoping that that's not the case. And so uh, we're going to have the AIs defending, the castle walls the same way we have, the bad AI trying to get in.
So, we had a previous speaker mention the term shadow AI. We all know what shadow IT is.
Yeah.
I'm sure that you and your CISO get to worry about and try and locate and catalog shadow AI, right? And also
Yeah.
educate your staff and your team members about the importance of knowing when and how and if to deploy their own AI. And also other threats like phishing attacks, which are getting much more sophisticated. And we've done phishing training, right? But now we've got a whole new level of sophistication enabled by AI. This is all affecting your employees. How are you working with them to, find shadow AI, get it under governance, and also educate them about the threats they'll face individually and personally?
Well, I think, part of it begins with endpoint management. We control those endpoints and what gets loaded and what doesn't get loaded. But the other thing is it's kind of like phishing. Even though that you have great phishing campaigns and you've educated your teams, uh, and I'm going to say this out loud, you can't fix stupid. Is that if you can try to guard against every possible contingency, but it's not going to be there. And so you have to have the other things, the same way we have NLP and a lot of other things in the organization. So we can watch people try to exfiltrate out data, and we stop them. We have unfortunately we've had individuals who that work are used to work at Franciscan that thought that the parts in the depot were theirs to do with what they want to. And we have technologies that if they power that motherboard up and it's not where it needs to be, we know it. So I think it's a variety of tools that we have to have, but we have to educate our everyday individuals, and it's not going to be the regular, the floor nurse, or it's not going to be a respiratory therapist. They may hear about the AI and what a wonderful thing it is, but then we have also internal processes. If anybody wants a project to do something, there's at least a security assessment, and we've instituted a technical assessment as well. It doesn't get implemented until it crosses those two barriers first, and we try to do those very quickly. And of course, then we have our, if it's a contractual thing, we have legal review and a bunch of other stuff as well. It takes a little bit longer to be flexible and agile, but there's a balance you have to do between associated with the risk of the enterprise.
So the next area I want to talk about is medical devices. So we
Do we
know
have to?
that, this is it's an amazing challenge, right? And we've been
Yep.
talking about this challenge for 20 plus years, right? We have some organizational challenges. You've got IT working with clinical engineering,
Yep.
biomed, things like that, where they own devices, they deploy devices. Now they're already connected to the internet. Now some of them are actually embedding AI modules. And
Yep.
and yet at the same time they're connected to patients. So of course this is a huge risk area. So how do we work across the organization to secure these devices? But we've got to continue to use them. Sometimes they're not upgradable, or we have to upgrade them quickly. I mean, how do you help make sure that they're safe for patient use and they are not vulnerable to these new threat vectors as much as
Well, and
possible?
I'm thinking you're not going to take day drinking as an appropriate answer. But I have a great partner in our HTM group. She's got a lot of experience, and we've latched onto each other. And so there's a triad. It's myself, the CISO, and our HMT director, administrative director. And so, but she reports up through another part of the organization. She does not
Right.
report to the IT organization. She reports up to quality and safety, which is fine. And it doesn't really make any difference to me where she reports to, as long as we work together. And we do. Karen and I have done a lot of things related to medical devices. We're consolidating everywhere we can. We're standardizing everywhere we can. And in doing that, not only are we making the organization less vulnerable because we're limiting those attack vectors as much as we possibly can, we're standardizing those and everybody is aware of it. We manage the ISP, my team managed the IP space, if I get it out right. It's late in the day. And so we collaborate with Karen's team and we give them the IP ranges that they work. We put in software that we can see and visualize everything that is connected to the network. And, I look at it on a, not every day, but on a regular basis. And I've watched that number of devices grow over 100,000 devices, a piece of equipment that's physically attached to our network. That does not include our guest net. Of our patients and visitors bringing their own technology door. We don't look at that. That's kind of noise I don't want to hear. I know it's there, but I'm not managing it. We're filtering it. We're providing that access. And actually, I know that there are more devices connected to that network, to our guest network, than there is our physical production network, which scares me to death. But we're also in the middle of putting in a network access control solution. So if the network doesn't know you, you don't get connected. We haven't decided where we're going to shunt them off to an internet connection or we're going to shunt them off that says, sorry, Charlie, you can't connect. But I think it's very important for us to know. The other thing that we're doing is putting in a zero trust infrastructure for our network. We're on year 3.5 of totally re-engineering our internal edge switches, our core switches, and our border firewalls, which are managed by our security team. We manage the NetSec firewalls at each one of our facilities to do the north, south, east, west traffic, and they are the teams are, I'm so proud of our teams. I was talking to my cloud architect this morning. We have a great relationship with the firewall team and the security team and my team. And I think that's paramount and important. It's, because security is everybody's job. It's not relegated out just to the security team over here.
Right.
It's all of our responsibility to make sure that we're not doing something stupid today that's going to put your organization at risk. And so that's connecting hardware. So one of the things the network infrastructure we put in place, we still have a lot of UTMs, the mini firewalls that all of our clinical equipment sits behind, but we're changing that infrastructure. So we're actually, I can manage every port on our network and configure it as a firewall. Same way we do the UTMs. And the other beauty part about that is, since it's centrally configured, if somebody goes into the closet that's supposed to be there and unplugs a device and plugs it into another port, the controllers will reconfigure that port to whatever that device needs because it knows what device just got plugged in. So that's some of the what I call modern management of the network, and we're about to totally re-engineer our WAN again. This is the third time we've done it since I've been here in almost 7 years. Because the threats and the technology continues to improve, and so we have to, I'm not going to say stay in front of it. We are trying to stay as current as we possibly can because I know if you've ever heard my analogy of the buggy, the mule, and the bungee cord and the concrete block. Don't have time to tell it to you, but I will at Fall Forum when we see each other. How about that?
That sounds good.
It's a good story. It makes a good visual. So
It sure does. I want to talk about, more cross-organizational collaboration, and
great.
medical devices is a great example. And that's third party and supply chain risk, right? So your medical device vendors are third parties, they're part of your supply chain. We have new challenges there, right? We think we have, a process for third party risk management, and all of a sudden we've got embedded AI in different places. That means your contracts people are involved. You're working outside with your vendors and vendor organizations to talk about how that can be leveraged, those kinds of communications and collaborations to manage third party and supply chain risk and get ahead of it.
Well, I mean, I think one of it is really around policy, and then the execution of that. What we try to do, and I think we do it more often than not, is uh, things do not get in the door unless we know about it. We're pretty strict about that, to be totally honest, and that includes me. If just because I want to put something in, I have to go through the exact same process. Everybody in IT has to do the same demand process for projects and stuff that everybody else does. And so, and the other thing is those partnerships throughout the enterprise, of making sure that those departments that are going to be putting in that kind of equipment, they feel comfortable having conversation. IT has a tendency to be labeled as the Department of No.
Right.
And we're not that. It's not now, is that because of other priorities and stuff. And so, but I think if you and I'll give you a perfect example. Some of the first meetings I went to with Karen, she invited me up to West Lafayette, meeting with Philips. We have Philips cardiac monitoring throughout the enterprise, and Karen was wanting to consolidate it. And I run the infrastructure that my teams run the infrastructure that all those monitors and stuff run on. And so we collaborated on to consolidate that in working with the Philips teams and stuff. They know who to talk to. And because I have a radiology and an imaging background, when we put in Philips PACS, which we have over 150 imaging modalities, the large ones, I was very involved in that implementation and continue to be so today, because I can speak PACS, I guess. And so I think you have to be approachable, and you have to be a partner. And if you're not a partner, then I think people are going to find ways to work around you. And so I think if you're in those positions that you know that you're going to have to be managing the technology and working to get those technology stacks in place, the people that are the recipients of that in the operations areas, they need to know that you can be approached and you'll partner with them in order to get the best solution in that's going to be appropriate for the enterprise.
So, sticking with the theme of third party and following up on AI as well, we know that our vendors are embedding AI modules. We've mentioned Epic, but also potentially some medical devices as well that are
Yep.
connected to patients. So it may be in an upgrade. It's not something that's new coming in the door. So how do you manage that? How do you make sure that everyone's aware that it's there, that it's using your data in cases where it's connected to a patient? How do we manage the both cyber risk and the patient safety risk of sort of new embedded technology that you're not managing, that's being sort of given to you?
Yep. Well, and you're kind of hitting on these what we refer to as vendor managed solutions.
Right.
One of the things that we started doing a long time ago, if it requires hardware, and the hardware is not considered part of that FDA medical device, it's my hardware. We manage it and we control it. And so the other thing that we do is have some very very good attorneys. I have two
Yes.
that are dedicated to IT. Well, I shouldn't say dedicated, but they're the two that I work with all the time. They are absolutely fantastic to work with. And they're the first two attorneys. Well, I guess I have one other in another company I work with, but these two ladies, they're just excellent to work with, because I love to work with attorneys that don't tell you no, you can't do that, but they tell you, okay, this is how you can do it. So
Right.
you have to go through the discovery process of finding out, one, the language in the contract, even though the contracting attorneys will try to do their dead level best to color it in a way that doesn't sound like they're going to use your data or there's embedded AI. But between the reviews that I do, that Jay does, who is also GD, he's a CISO, but I call him an attorney. He doesn't like it when I say that, but his wife is an attorney, and then we work with the attorneys to figure all that out. And when we're doing our technical assessment, all that stuff can be ferreted out if you ask the right questions.
Awesome. We have a question from the audience, and this pertains
Yep.
to you re-engineering your WAN. Have you considered 5G with the intrinsic security capabilities as part of the equation when you're doing this next upgrade?
Well, as a matter of fact, yes, and private wireless as well. And so I've been fortunate enough to be asked, and I'm not going to name the vendor, but I've been asked to sit on their technical advisory board for healthcare. And I don't know why they want this demo country boy there, but I'm happy to do that because it'll give me access to some of their newer technology. But the one thing that I'm reminded of is that and the thing I'm really interested in, particularly on the private wireless side of things, that I can decrease the number of APs, and then by doing that, I can decrease the number of pieces of equipment that I have to have in my hub rooms and that kind of stuff. We've only started scratching the surface, and that was the reason we chose this vendor, because they bring to the table a lot of new and interesting technologies. Some of the things we're doing related to survivability in the event that, when we get hit with a cyber attack. How do I make the network survive? And so we're looking at Starlink as well. How do
Okay.
we can create that? Because the one thing that we know is that typically when people get hit with a cyber attack, what's the first thing they do? They shut their network down. Well, if
Then
you're
you,
running voice over IP, and you're running a bunch of SaaS solutions and stuff. If you have no network, you have no internet, you have no phones, you have nothing.
right.
And so using your POTS lines, or now the non-POTS lines to do emergency phones and stuff, that's not enough. And so we're re-engineering through our service provider for our voice over IP phones and how to make that network survive. And those are some other things that we're working with our vendor around our WAN survivability as well.
That's great. Thank you. Um, if you were to give the audience some advice, they're all dealing with digital health innovation.
Yep.
What steps would you advise to just sort of manage cyber resilience in the environment where there's such a push for innovation on the clinical operation side, and also a focus on patient trust? I mean, we've left that out of the conversation a bit, but
Yep.
patient trust is also something that we all worry about.
Well, I think on the trust side, Lisa, it's one of the things that my father told me a long time ago. There are two things that you're given when you're born. That's your integrity and trust, and you have to give both of those away. And so we will have our patients trust until we give them a reason not to trust us. And so, but I think that for me personally, what I do is, I try to be available. We try to educate. One of the things I learned when I was in Georgia and we were struggling to get an EMR, standard EMR rolled out through the enterprise, I started making rounds to the physician practices. And I never really realized how powerful that when you have the senior vice president CIO, which I was in that organization, wander into the practice. Now the practice managers knew I were coming, but she always knew that there are two people in the office I wanted to talk to: the physician and the nurse, his nurse, her nurse, because I wanted to see them. And so the office manager always let them know that I was in the building, and we always had a conversation. So I found out later that that was one of the reasons that helped turn that implementation, is because I made myself available to them, good, bad, ugly, and used to go down and sit, have lunch with them, had breakfast with them, and left my self open for, and sometimes abuse. So it wasn't a bad thing. It was a really good thing, because you create those relationships, and so you really truly have to have those relationships of open and honest dialogue. But the other thing is you have to continue to learn. I'm a lifelong learner. I read as much as I possibly can. Don't get to read as much as I used to, and it's reading, not it's not nonfiction. Stephen King couldn't write some of the books related to cybersecurity and the stuff that I read, because it scares me more than Tommy
Yeah.
knockers did, to tell you the truth. So.
Well, thank you, Chuck, very much for your insights and for participating today. I feel honored to have you here.
Well,
Um,
thanks very much.
Thank you. Frank, I will turn it over to you for the next session.